American Hospital Association. Fact sheet, well, that's undecided, but healthcare workplace violence and intimidation and the need for federal legislative response. Nazism. That's what your associations support, whether the members realize it or not. They want the federal government to control everything. So I said yesterday that socialists will go to any means possible, any means, anything justify whatever they have to do, they will do it. So, really what I would ask, American Hospital Association, American Nurses Association, Emergency Nurses Association, all of you healthcare associations, is why did you all support open borders? Because that would lead not only to the overwhelmment of the hospital, which you guys all carried on about during COVID, but it also leads to all these gang people coming in, and that will lead to violence. But it serves your purposes. It serves your purposes to force America into the federal government handling healthcare, which would be the worst. That's the worst thing to do. There's a reason, again, for those that do not understand that we are not under the free capitalist system. The socialists want to tell you capitalism is the problem. No, it's not a true free capitalist system. We live under crony capitalism. That is a problem. That's who these people are. That's who your nursing associations serve. They serve elitism. This Dr. Gali, this was from several years ago. He short, you can find it, it's on, I think it's PubMed, summarizes the state of medicine today in the USA in his essay, What Happened to the Patient First and Do No Harm Medical Principles. Socialism happened. It's exactly what this goes on to say. He had lived through it, so he recognizes it. That is what is happening. That is why where I work, the corporate department would put in a nurse that has, as a chief nursing officer, has no psych experience. Okay, but because she comes from an association level, and all these different entities of the associations of healthcare are the problem. They are the problem with healthcare. They are the reason there is violence. When you are a nurse that will go to the lengths that I've seen this woman go to stress nurses out, to give them more patients than they can handle, and they already have too many that they can handle, and you do not provide safety for them. Here's the worst part. It's fine. You can get off on this idea that you can't help if somebody gets violent. But you can sure as shit say, no, we shouldn't take somebody because we don't have the staff for it. But this chief nursing officer where I work, oh no, it doesn't matter. It doesn't matter if there's been 3 call-ins and there's no staff to barely cover all the units. She will not put a cap on admissions. See, for people that do not understand, the psych area is different from all the other floors. Like, you can't just deny patients. I mean, in other areas. And no ER can deny anybody. Then that doesn't go on. But what I'm saying is that when it comes to doing an inpatient psych admission, what this emergency room chief nursing officer, who's only chief nursing officer over a psych facility, that's not part of a hospital, just psych. She doesn't even understand psych because she's an emergency nurse. Okay? She likely tells herself she does, but she doesn't, because she's been brainwashed by the associations of healthcare and nursing. They are driving our country into the ground because they are hell-bent on pushing that there's violence in healthcare. And really, they don't focus on the violence that happens in psych, because to some degree, you can expect that. You're dealing with psychotic patients. However, when you have a high acuity unit of violence, and then you tell nurses they have to take more than what their nursing ratio calls for, and then you just say admit anybody, then you are an irresponsible nurse. Irresponsible. But she serves her associations of healthcare, nursing, hospital associations. She serves elitism. She serves the corporate world to force government-run healthcare. Same thing Hitler had. Same thing Hitler had. And that's what this article, the best article, I've done a video about it a while ago. Read the article. You can find it, Dr. Ghali, about the problem with healthcare today, and it is associations that tell you that they're fighting for staffing ratios. Do you know why they're fighting for staffing ratios? Because they want the federal government to step in more and more and more. And then the next thing you know, the federal government, once you get them in, you won't get them out. And they don't fix anything. Every time the federal government gets involved in anything, I mean, they can't even manage the hurricane disasters right now, okay? So this is how bad it is when you get the federal government involved. Yet the nursing associations forever have been on this socialized medicine bullshit. And they have convinced millennials that socialism is about everybody. No, it kills everybody. It kills morale. I work in a place right now, there is no morale. But I've worked in places where there is. And it's all dependent, first of all, on having the right leadership that has a moral compass. And it all is dependent on having staff. They are going out of their way, all the healthcare associations, to make everything look horrible. And they're actually doing it because they put chief nursing officers in, like where I work, who will deliberately cause stress to her staff. She's deliberately doing it. Otherwise, she's an idiot. I mean, I don't mean that as an insult. You'd have to be an idiot with no brain. You'd have to know, look, I shouldn't be forcing more patients past the ratio that we call for, and we already have a ratio that's too high. But I'm going to be a chief nursing officer that's going to say you have to take more. No, you should be. It's really simple. You wouldn't need any of these associations if you had nurses at the leadership levels that stood up to corporate. Yes, I understand it means you might get fired, but if enough people did it, then maybe people in corporate would start. All these people need to be held accountable. The other thing pushing all of this, there's this violence in healthcare, is that, again, it's to get rid of guns, okay? Because the same people, all the healthcare associations that are carrying on about this, are the same people that supported open borders. So they supported things that are not healthy. You should never support open borders. Again, leads to more trafficking, as I say a million times. But it leads also to all these gangs that Trump's been talking about that are coming in. The Laga Tren gang, MS-13. They're armed. So that's what a disgrace, but I mean, Kamala Harris has been a disgrace person in the history of her career, period. Okay? But again, these associations support Kamala Harris for president. You know why? Because she will take your healthcare system into the same healthcare system that Hitler had. Yeah, go ahead and say that's somehow me exaggerating. Bullshit, it's already almost there. There's a reason all these tentacles of associations have gone out into every state. They're everywhere. And they put those nurses at the top positions. Because those nurses, whether brainwashed or stupid or just corrupt, serve the socialized system. We do not need socialism in this country. What we need is our free capitalist enterprise system back. I don't know how you get that back, because along with all the healthcare associations supporting the biggest elites of the world and the corporate world at the World Economic Forum and the UN that have all monopolized everything, I don't know how you break all that up at this point. But I sure as shit know this. None of these people, if they're tied to any of these nursing associations and they put them in leadership levels, should be trusted. And just watch their deeds. Their deeds will show you who they serve. Their deeds will show you that what their overall goal, even if it means they have to help support violence, is to get to the same healthcare system that Hitler himself put in place through medical associations.